Hello, my name is Brady Kirkman, Executive Director of Marketing and Business Development here at Wyndham Area Health, and welcome to The Pulse. Today we have with us Dr. Dickus. Hello, Dr. Dickus. How are you?
I'm doing well. How are you, Brady?
I am fabulous. So you're an ophthalmologist that comes to Wyndham Area Health, correct?
Yes.
And talk to us a little bit about, how often you come and some of those services that you provide.
Yeah, so we come to Wyndham twice a month, the first and third Wednesdays of the month. And main thing we do is cataract surgery. We also do some after surgery lasers that we can do here. There's a lot of people in the region and just a lot of people in general that need that service. So we're thankful that we're able to come here twice a month and provide that service for patients.
Well, and I think you cover about an hour, maybe radius. Would that be fair to say?
Yeah, I would say hour and a half, maybe. I cover Wyndham, and actually one of my partners goes to Worthington. So between the two of us, we're able to cover kind of a broad range of area for people. Yeah.
And when you speak of your partner, obviously you're coming from the Sioux Falls, South Dakota area as well. Yep. And talk to the group a little bit, the listeners, the difference really between an ophthalmologist and an optometrist, if you would.
Yeah, so obviously we both deal with the eyes, but so it's a little bit different in our training route. We go to medical school and then go on to additional training in ophthalmology, surgical training in ophthalmology. An optometrist go to optometry school. And so it's just a little different. We head down that surgical path. And so main differentiating factor is that we do surgery and they don't. But so there's definitely a vital role in eye care for the general population. But when you need surgery, then you're referred to an ophthalmologist.
Okay. Yep, makes perfect sense. Well, obviously there are probably more optometrists in our area than there are ophthalmologists. Would that be accurate?
Yeah, there's many in the area. And I'm the only one that comes to Wyndham for the surgery, for a surgeon. Like I was mentioning, we cover Worthington as well. So there are a lot of great optometrists in the area to provide primary eye care, and then I'm glad that I can come to the area to provide the surgical eye care.
So, when people hear surgery, I'm sure they get apprehensive. Are there any long-term effects if a person really pushes off that cataract surgery that they should be aware of? Yeah,
we do encourage to do the surgery before it gets too dense, because there is such a thing where if you kind of wait too long and the cataract gets more mature, there are more complications that can happen during surgery. It is still pretty rare, but that's where we like to, once you're starting noticing changes, go in for your eye checks. If the cataracts are ready, it's better just to get them off once you're noticing those changes.
And would you say it's fair that, once those cataracts are removed, individuals have a pretty substantial change in their vision?
Yeah. Even by the next day, it's usually a pretty dramatic change depending on how dense the cataract is. Mm-hmm. The denser the cataract, the more dramatic change you're going to get. But yeah, people definitely, brightness and colors is always the first thing they notice, and just clarity in their vision, getting that clear vision back.
Well, that should be a motivation right there alone to do that sooner than later.
Yeah, exactly.
Are there any points that you would recommend telling your patients, advice that you'd have with them?
I guess just get those eye exams, just because things can creep up, especially, over age 60, it's good to have a yearly eye exam. Things like glaucoma, which is one of my specialties, can creep up on you and you won't know you have it till it's kind of too late. So that's one of the reasons to see your primary optometrist and get those eyes checked in general. They check your pressure and look for macular degeneration, different aging conditions that can sneak up on you.
And if a patient, they were referred to you, is it hard for them to get in, or how's that work?
Yeah, I don't think it's terrible. We are pretty busy when we come here, which is good. But I think if you want to get in, you can usually get in within a month or so.
Okay, excellent. How do you connect with your patients? They come and they see you for the first time. How do you kind of make them feel at ease and at peace with what's going to happen?
Yeah, so they meet with myself. Before me, they meet with my staff who does all the testing. I think they answer a lot of their questions along the way. Then when they get to me, of course, we go through the whole eye exam, try to educate them on what's going on with their eyes, and answer any questions they might have. It is hard because we do only see each other one time before surgery, but I feel like we do a good job to put them at ease and make them feel comfortable.
And if they want to schedule an appointment, how do they do that?
Yeah, they can just call our office, and then we can get them set up.
And what's that number?
605-336-6294.
Perfect. Well, I thank you for joining us today on The Pulse, and we'll see you next time.
All right. Thank you.